right? So first heart sound is produced due to by the closure of both the tricuspid and mitral valve, and second heart sound is produced due to the closure of aortic and pulmonic valve during the beginning of isovolumetric relaxation, and the third heart sound is heard during the rapid ventricular filling. There are two phases. In the first phase of ventricular filling, that is called rapid ventricular filling, the blood gushes into the left ventricle from the atria, produces S3 heart sound, that is rapid ventricular filling. And the fourth heart sound, here after filling of after atrial filling with the blood, the 60 to 70% of the blood passively rushes into the ventricle, right? So the rapid rush of blood from the atria into the ventricle, that in the rapid ventricular filling phase, the S3 heart sound is produced. After the rapid ventricular filling, some amount of blood present in the both atria, right? For example, the 100% of the blood is filled with both atria. In the rapid ventricular filling, only 60 to 70% of the blood passively, there is no need of atrial contraction. Remember this point. Without any atrial contraction, without any energy, passively the 60 to 70% of the blood from the atria rapidly gushes into the ventricle, rapid flow into the ventricle, that produces S3 heart sound. So remaining 20 to 30% of the blood which is remained in the both atria in the second phase of ventricular filling, in that period atria is contracted. In the first phase of ventricular filling, without any force, without any atrial contraction, blood is rapidly rushes into the ventricle, produces third heart sound, and after the rapid ventricular filling, the blood which is remained in the atria, 20 to 30% of the blood which is remained in the both atria needs atrial contraction, that is called atrial systole, which produces fourth heart sound. So diastole is also one phase is there. These all the phases are present in the events of cardiac cycle. Already you people know. So fourth heart sound is produced due to the contraction of the atrial systole. Contraction of the atria, that is called atrial systole, produces S4 heart sound. So remember, simply I will explain you once again. During the cardiac cycle, in the cardiac cycle, there are two events are present. One is systole, another one is diastole. Systole nothing but contraction, diastole nothing but relaxation. In the systole, there are three events. Three phases are there. One is isovolumetric contraction, rapid ejection phase, and slow ejection phase. In the diastole, there are five phases are there. That is called protodiastole, and isovolumetric relaxation, and rapid ventricular filling, and atrial systole. There are four types of, in the four types of four heart sounds, the first heart sound heard during sudden closure of both AV valves. Remember this point. In the just at the beginning of the isovolumetric contraction, at the beginning of ventricular systole, both AV valves are closed, which prevents the backflow of blood from the ventricle into the atria, right? This closing of both AV valves means tricuspid and bicuspid valves produces first heart sound. After the ventricular contraction, due to the closure of semilunar valves, the ventricles are emptied, the blood which is present in the ventricle pumped into the aorta and pulmonic trunk. After that, ventricles get back to normal, right? During the relaxation of the ventricle, for the prevention of the backflow of blood from aorta and pulmonic trunk into the ventricles, both semilunar valves are closed. This closing of aortic and pulmonic valve produces one more sound that is called second heart sound, just beginning of the isovolumetric relaxation. The exact answer is the protodiastole or at the time of isovolumetric relaxation. After the relaxation of the ventricle, the atria, both atria are filled with the blood. This filled blood rapidly pushed into the ventricles. This rapid inflow of blood from atria into the ventricle produces another heart sound that is called S3, S3 gallop, right ventricular, rapid ventricular filling. After the almost the 70 to 80% of the blood which is present in the atria are passively pumped into the ventricle without without atrial contraction. There is no atrial contraction in the rapid ventricular filling. Passively, just without any force, without any atrial contraction, the 70 to 80% of the blood from the atria pumped into the ventricle. In that phase, S3 heart sound is produced. After rapid ventricular filling, 20 to 30% remaining blood is present in the both atria, which again pushed into the due to the atrial contraction or due to the atrial systole, the remaining blood pumped into the left ventricle produces another heart sound that is called fourth heart sound, right? Atrial systole, ventricular diastole, atrial diastole, ventricular systole. So this is the mechanism of the cardiac cycle, right? So these are the four heart sounds. First heart sound, second heart sound, third heart sound, fourth heart sound. First and second heart sounds are called high pitched heart sound, like lub dub, lub dub. Lub means first, dub means second. Third and fourth heart sounds are low pitched heart sounds. Physiologically, these two heart sounds S3 and S4 are not heard during the physiological condition. They can only heard in the pathological conditions only, right? Sometime S3 heart sound can be heard in children's and as well as in pregnant women also, right? So this is the topic of heart sound today. So if you have any doubt, don't forget to leave a comment in the comment box. In the next session, we will discuss about left ventricular pressure volume loop. This is the very important topic. If you understand the cardiac cycle events, systole and diastole, what is isovolumetric contraction, ejection phase, slow ejection phase, protodiastole, isovolumetric relaxation, rapid ventricular filling and atrial systole, definitely you will understand the left ventricular pressure volume loop, right? So in the next class we will discuss about that. Don't forget, and if you have any doubt, please leave a comment in the comment box and don't forget to subscribe to our channel New Sai Apollo Hospital and Healthy Talks by Dr. Anti. Have a great day.